Thyroid gland. Thyroid gland produces two hormones, thyroxine T3 and T4. So for producing these two hormones, it required iodine. From the iodine, these two T3 and T4 are synthesized to produce this hormone. And this thyroid gland is under the influence of one hormone called thyroid stimulating hormone, which is secreted from the hypothalamus. So in order to understand clearly, we need to focus mainly on four parameters. One is we need to assess whether the patient is producing enough T3 and T4. At the same time, we need to understand whether the thyroid stimulating hormones concentration also, because whenever the thyroid stimulating hormone is increased in our body in order to produce more T3 and T4, in such a case, if the body is not capable to synthesize T3 and T4 from the iodine, it shows a deficiency of T3 and T4. At the same time, the thyroid stimulating hormone will be in a higher range in our body, from which we can understand that whether patient is in the deficiency of T3 and T4. In such a case, we need to give the thyroid T3 and thyroxine T3 and T4 in a tablet form to the patient. The main function of this hormone is to increase our metabolic rate. So whenever this is reduced in our body, patient automatically not able to produce enough metabolism. When the metabolism produce, the heat produce. So instead of the heat, patient feel the coldness because body is not able to produce the metabolism, maintain the metabolism. If its level is very high in our body, the patient shows the opposite reaction, which is patient feel very hot. The reason is that it increases the metabolism. So in addition to this is the main symptoms from which we can understand whether it is hypo or hyper. And at the same time, there is one Hashimoto problem also. It is an autoimmune disease which affects the thyroid. Thyroxine is produced in our body. T3 and T4 is produced in our body, but at the same time, our body is not capable to use it because one antibody is produced generated in our body in order to destroy all these cells. So these are the four reasons. From these four options, we can understand whether patient is suffering from thyroid related disease. So all this investigation is also important to understand which is the root cause of the thyroid gland or the thyroid function. Thank you.